Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we'll be talking to Dr. Arun Garg, who is the founder of Canada India Network Society. And recently, he was away to India where he had good deliberations with the concerned authorities about various things. So, let's update you about what is the work being done by CINS and how it is affecting the common persons also. Let's get Dr. Arun Garg on air. Dr. Garg, good evening. Welcome to the program.
Good evening, and very happy to be with you again, as always.
Thank you very much, Dr. Garg. So, recently you were in India. I would like an update as to what were the deliberations that took place between you and the authorities over there. What has CINS achieved in this past few months?
Thank you. Always a pleasure to share with our viewers the work of Canada India Network Society. As you know, both your show and yourself and us have been working together for so many years. I would like to start by just sharing with our viewers that we are making progress in the sense now. When we first started to talk about chronic diseases, lowering the burden of chronic diseases, there was very little out there, and people weren't really listening or were aware of it. But now I think it's really taken off, and especially with all the healthcare sustainability and all the problems, people are saying what we have to do different. So yesterday I attended a workshop organized in Surrey by a business association, and they were talking about wellness and the role of people in their own care. So in some ways, we're very delighted that the effort we made 10 or 12 years ago are come to fruition uh, in building healthy civil society, and that is very satisfying. Obviously, a lot of work has to be done, but I thought I'd just share that with our viewers because it's important to have that feedback. We are also working, CINS is very actively pursuing this year some roundtables. So we'll be having roundtables on the role of women in lowering the burden of chronic diseases. We had one on youth, we had one on professional, and last year's meeting on women's health, we are having also supporting a roundtable. So all in all, that work is going well. This particular visit to India was a follow-up because our efforts are dual. We also work locally, but
Right.
also globally, what we could do in India, people to people outreach. And so, in that context, we have some partners and collaborators, and we took this opportunity to renew our relationships. This year, we were also very fortunate to have a new partner in Dr. Anurag Saxena from University of Saskatchewan. He's very active in India. So rather than duplicating our theme always been collaborate and work together. So this particular visit was a uh, visit by three people: Dr. Graham Dixon, who has been our partner from Leeds, Canada, and Dr. Anurag Saxena, and myself. And we visited, it was 10 days of very hectic but very active work. And so we started out with Quality Council of India.
Okay.
This is a group I've been very, very interested in for some years, uh, but haven't made the contact. So we were able to make contact this time because of the work Leeds is doing and the work Quality Council is doing and the work Dr. Saxena is doing. So I think this partnership really supported this work. So we started our visit to India by coming and meeting Quality Council of India. They were very generous. Their Secretary General, Dr. R.P. Singh, met with us and welcomed us, and we shared with them what we are doing. I was able to bring the focus. It was all about Leeds work, the Leeds program we are doing in India and how it affects Indian health system and what we could do jointly. But I was very pleased that I was able to bring that leadership program is really leadership for India, by India, of India. So my major theme was that this leadership comes from within, and the integrated approach to solutions and integrative thinking about leadership. So it's not just that you go to Harvard and pick up some messages, and that's the cookie uh,
Right.
formula you use. So that was we were able to reaffirm that. That was very well received.
Right.
They have asked me to contribute some in their literature, and we are hoping that we will be able to work with this group. Now, a little bit about Quality Council in India. This is a very, very critical organization in India, which is dedicated not just in health, but very broad society approach, industry, uh, the various groups for quality. So
Right.
this is a umbrella organization which provides support for quality, and they do that through many different ways. And one of them ways is having accreditation. So essentially, they have standards of care, and then you have to meet those standards to have accreditation. So that is a very great interest to us at CINS because, as you know, we have talked many times. We feel that Canada has fair amount to offer in terms of improving care,
Right.
and I was very pleased that we were able to achieve that in a very short time. So, with the help of Dr. Saxena from Saskatchewan, Dr. Dixon, our own, who have been on your program before, for leads, LEADS, lead yourself, achieve results, engage others, develop collaboration, and think of the system. Those five principles, which are so very, to me
Essential.
anyway,
Yeah.
yeah, and also they rhyme very well with Indian psyche. So I
Right.
think there is a real potential.
Oh, that's wonderful. Well, Dr.
I
Garg,
covered a lot of
yeah,
ground on it.
absolutely. No, no, that's very critical, because the progress that has been made over the years, when, still this thought was in its infant stage that we bring in the integrative approach, which is coming forward in a great way. So, what else happened in India? Let's go for a break. We'll be back and then we'll learn more from you because the best of the West and the East, when they integrate, then definitely we can have some crucial improvements in the healthcare system, and that is what you aspire to. So, we'll be shortly back and we'll learn from you, Dr. Garg.
ਹਰ ਰੰਗ ਹੈ ਸਾਡੇ ਕੋ ਹਰ ਮਾਡਲ ਹਰ ਇੱਕ ਦੀ ਆਪਣੀ ਵੱਖਰੀ ਪਹਿਚਾਣ ਅਸੀਂ ਇੱਕ ਪਰਿਵਾਰ ਹਾਂ ਸਾਡਾ ਕਰਮ ਹੈ ਅੱਗੇ ਵਧਾਉਣਾ ਸਫ਼ਰ ਨੂੰ ਸੌਖਾ ਬਣਾਉਣਾ ਬਸੰਤ ਮੋਟਰਸ ਤੁਹਾਡੇ ਨਾਲ ਤੁਹਾਡੇ ਕਰਕੇ
है जुल्म ढाने का अंदाज भी कितना हंसी हमारी जान पर बनाई है जब जब उसने अंगड़ाई ली कभी खामोश रहते हैं कभी शोर होता है मोहब्बत में शरारत का मजा कुछ और होता है दिल को जज्बात का तोहफा खामोशियों को बात का तोहफा खूबसूरती में जड़ी नजाकत अदाओं की चांद से मुखड़े को चांद सा तोहफा
भारत ज्वेलर्स सच्चे प्यार की चमक जैसा फाइल बिजनेस सेंटर सरी
ਕੀ ਤੁਸੀਂ ਸਰੀ ਡੈਲਟਾ ਰਿਚਮੰਡ ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 6048259295 ਉੱਤੇ
Once again, welcome back to the program. My guest today is Dr. Arun Garg, who generally is a co-host with me because recently he was away to India. So we are giving you an update as to what were the deliberations that took place in India and where CINS has been able to bring this aspect of integrative approach because it's very essential that when we see the best of the West and the East, when it amalgamates, we can have wonderful results, and that's what CINS is trying to do. So let's get back, Dr. Arun Garg, but before that, this program is being brought to you with the support of AMC Insurance. If you're looking for home, auto, travel, business, life, or recreational insurance, they have 9 branches in the lower mainland to serve you, and they're open 7 days a week from 9 a.m. till 9 p.m. For more information, you can call them at 604 507 6666. Our next sponsor is Agnihotri Immigration. If you are wanting to come to Canada, you want critical information as far as immigration is concerned, you are a PR, you are a student international, or you want to sponsor parents or grandparents, you can talk to Neera Agnihotri, who has been a certified immigration consultant since 2006. She assures you of honest and reliable information. You can call her at 604 597 2284. Let's get back, Dr. Arun Garg, and continue with our discussion. So, Dr. Garg, as you mentioned, what I have seen the progress, there was a time when nobody wanted to talk about this integrative approach. It was just one-sided approach from both the sides. In India, it was something different. In Canada, it was something different. But gradually, your efforts are taking ground, and we are seeing some improvement. And as you mentioned just yesterday, you attended a conference in Surrey where these things were talked about. So that's a great accomplishment, and kudos to you and to your team that who have been working relentlessly to bring this message forward. So congratulations for that. Coming back to India,
Thank you.
while you had a meeting with Quality Council of India, so what else did you do over there which helps in letting our viewers know that some concrete efforts are being made and we are getting some good results?
Yeah. So, as I said, Quality Council is an umbrella organization. So they have many different activities, and one of them is improving the quality and standards in healthcare. So they do the accreditation of the hospitals. So we were also able to meet the executive director and the leader of hospital accreditation group, Dr. Kocher, and who hosted us, and we explored potential how CINS, but more importantly, LEADS and our sister organizations can work with them in providing some Canadian skills for enhancing the standards. So we're hoping to explore those further with them. But again, Dr. Kocher was very happy to see that we are bringing approach of leadership which is tailor-made and is for India. So we are not going there and saying we have a recipe or we have a solution for India's problem. What we're saying is that we need to provide the essential foundation or essential pillars of thinking, which is integrative thinking for this. And he was very happy. So that was one of the activity as well. I should have mentioned at the start that this visit was April 10th to April 20th of this year. So we just 10 days we did this. Um, in addition to that, then we have our long-standing partner now of CAHO, which is a consortium of accredited uh, health organizations. This is an organization which was founded by Dr. Vijay Agrawal, who has become a good colleague, and he will be visiting us in fall. Courtesy of Dr. Dixon, because there is a international leadership conference. So the CAHO had their annual meeting, and to which they invited us to participate in the workshop. So Dr. Graham was the featured speaker, and I participated along with Dr. Saxena in a workshop.
Right.
So we put a workshop together, uh, pre-conference workshop on leads itself, and over 100 people registered for it, and we are hoping that that will increase the uptake on our course. As you know, we have a course now, a joint course, online course on leadership, which
Okay.
has been subscribed and taken by close to 40 doctors in India as part of their career enhancement.
Okay.
And so we are very pleased, and we are hoping this can go further in other areas where the principles of leads become the foundation for learning about leadership in the Indian context.
Mm-hmm.
So at this workshop, I presented my ideas of how the five tenets of leads, LEADS, as we
Mm-hmm.
talked about, also jive with what have been talked about for eons, and that is um, Raj Yoga, Karma Yoga, Bhakti Yoga, Jap Yoga, and Gyan Yoga. As you
Mm-hmm.
know, yoga is really a way of thinking, and it's the fusion of body, mind, and intellect. And to me, that is so critical in leadership. And we were able to connect those dots, and let's hope that it has some uptake in people's thinking, because I don't think you can find long term permanent solutions unless they are based on what you really believe in. So, just going to school and picking up some thoughts really do not bring that long term leadership of what is the right thing. Doing the right thing for the right reasons at the right time
Mm-hmm.
requires that inner passion for leadership. And I think
Absolutely.
that's what we are bringing in there. And it was again very well received. So I think that was very good. It was a full day workshop, a good 8 hours, and good interaction.
Mm-hmm.
And as I said, over 100 people registered, but because
Right.
of some traffic and all that, I think in attendance there were about 80 people.
Mm-hmm. Okay, that's interesting. Dr. Garg, let's again go for a break, and in the last segment, we'll learn more from you as to why your visit to India has been successful and you had a lot of interactions. But now, what are the future plans? What all is being done, especially in Canada? What is the new projects which you're going to undertake? And of course, the conference which is held where people from all over the world, the health specialists, join in. We'll talk about that also. So after this break, we'll be shortly back and continue with the discussion.
ਘਰ ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ ਅਸੈਸਰੀਜ਼ ਤੱਕ, ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀ ਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ, ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀ ਬਾਟ ਟਰੱਕ ਸੈਂਟਰ ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
Once again, welcome back to the program. Dr. Arun Garg is my guest, and we are talking to him about the update regarding his visit to India and how CINS, that is Canada Indian Network Society, is spreading its wings and trying to bring in an integrative approach in the healthcare system. Before we get him back, let's let you know that this program is being brought to you with the support of Abhishek Grover, mortgage broker from Sun Capitalist. His address is Unit 104, 105, 6678 152 Street. So if you're looking for a residential or commercial mortgage, he assures you of the best rates possible. You can call him at 604-786-1937. So Dr. Garg, anything else that happened in India which our viewers need to know? Any other accomplishment?
Yeah, so I think another very satisfying part was that during this conference, we were able to participate in graduation of certain students who have taken our course.
Okay.
So it was really good to see people, doctors who have taken the course, meet them, and give their certificate. So I think this is a online course which is
Right.
available to physicians and to others who are interested in leadership. And it's a leads program. So
Right.
CAHO, it coordinated through CAHO, our Indian partners, and anybody interested, especially your viewers who are watching in India, if they were interested, they can visit CAHO website, www.kaho.org, and then they could register. It's an online course. So
Okay.
that was very good.
Right.
And then finally, we were able to come back to Delhi, and because of the Dr. Anurag Saxena and his interest, they had organized a conference on leadership and the experience of COVID and emergency planning and emergency disaster. So CINS was able to participate in it in that conference, and it was a wonderful uh, one-day event organized by our local Indian partners, and we were just presenting leads, what is leads, and how leads leadership can help in planning. But what I must share with your listeners and viewers, Harpreet, is how impressed I was with the dedication and the enthusiasm and passion Indian providers. I take my hat off during COVID what they achieved. So it was organized by a local hospital, Lokmanya Hospital, and the leaders there in emergency. Uh, Ritu Singh was there, and so I think that was wonderful experience for me. Not so much of uh, taking things from Canada, but just learning how successful India was in
Right.
emergency planning, and they converted the whole Lam Leela Maidan in Delhi, which is a huge
Oh, yeah.
field, into a hospital. Just imagine the amount of work and organization which goes in
Right.
organizing this. So they shared how they did it. Their medical director presented that experience, and I was very pleased for many reasons. One, that they did it. B, the results were obvious, but very impressed with the organizational abilities and how well they did it. So
Right.
that was a very positive experience for us. And uh, I again shared at that session the leads program and its five pillars and how I see they're connected to Indian thinking. So leads is a natural uh, uh, program for Indian use when properly connected to
Right.
yourself. So again, our message is the same, but we
Right.
continue to take that, and it was well received.
That's excellent. So now, Dr. Garg, after the successful visit, you are back to Canada, and of course, CNS work continues. Anything particular that CNS is focusing this particular year?
Yeah, so what we are doing is we had identified locally two or three areas of focus. So one was last year's conference, we had women's health.
Right.
So we're continuing with that, and part of it is follow-up work with UVC, Dr. Lisa Dawson on women health, and we are helping them organize a roundtable on opportunities and barriers in women's health. Their main focus is lowering the burden of cancer and the especially in gynecological cancer, and what are the barriers for screening? Because generally speaking, it's felt that uh, Indian population is not subscribing fully to the screening as much as they could, because screening with the early diagnosis is important. So she is working on this project, and we are working with her to facilitate, to identify why people don't go for screening. What are the barriers? Are they stigma associated with it? Is it cultural, or just logistics or whatever? So that's one work which we are supporting and that hopefully will carry on for next rest of the year and will help in formulating some public policy around that. So that's very productive, and we're very
Right.
proud of that work. In addition to that, we are also partnering with the Institute of Health System Sustainability because they have taken upon promoting lowering the burden of diabetes.
Right.
So diabetes type 2, which is very much related to lifestyle. And there is a ever increasing thinking that certain types or certain within that type 2 diabetes, certain components are reversible. So diabetes, even when you get it, is reversible. But our focus also is prevention and health promotion.
Right.
So how to prevent it? And again, lifestyle plays a very big role.
Right.
And we are working with Institute to organize their capacity. Eventually, we are hoping this will all lead to building some community capacity whereby people can get all this information in one stop shop. I think if you look at in our system, it's bit somewhat fragmented, and we don't have a place where people can go on an ongoing basis, not just once. Like people that we organize meetings and all that, but that's like a one up. But a permanent basis is some sort of a community facility for public health which is associated with the institute. So it has to be affiliated and working with existing government and public institutes, but is also nimble enough and independent enough that can take some initiative. So that's the concept, and we are working towards that, and hopefully and eventually we will get there. But in preparation of this, we are doing a lot of homework in okay, what is the need? What are the gaps? What are the barriers? What are the opportunities in a cultural context? So we had organized a workshop, a roundtable with youth, and we learned that youth were very interested in their health, but they say again, what's missing is a safe place where they can
Right.
talk about it.
Right.
So I think that hopefully we could carry on. Now we're working to see, have conversation with women and see their perspective. Then
Right.
we are hoping we could take it to places of worship and have elders' perspective, have perspective of our esteemed Gurujis and Swamijis and who are very influential in people's behavior. So I think we will want to explore that further. So that's
Right.
planned over the next few months, and I think that's. In addition to that, we also supporting obviously Fraser Health that they've been very active in a lot of these public health things. They're very keen on bringing cultural safety, cultural sensitivity to care. So we
Right.
are providing any support there we can.
Right, and also, Dr. Garg, we are already in the middle of the year, and the next year we have the your next year we'll be having the conference also. So preparations will start for that also, because from all over the world you get in the best minds who interact with each other and try to formulate things which can be beneficial for the common people, and using the integrative approach. So things are moving at a fast pace and things are going in the right direction, but still, do you still feel that there is something which is kind of a barrier, and this message which needs to percolate down to the common people is not reaching at that stage which it should?
I think the biggest thing we could do is to have a community capacity whereby using existing drawbacks or areas, it could just be some innovative place. It could be places of worship. I was talking to one very senior doctor, and he shared with me that for our culture, we need to embed some of this in our places of worship.
Absolutely.
So I think, because our people go there, and if there was some capacity there for help,
Right.
so I think, and we really don't have. There are few people doing it, but they're doing it kind of on their own. If we could have some sort of public program which was
Right.
available through that, I think that will go a long ways.
Very true. Absolutely. Wonderful. Dr. Garg, in conclusion, what would you like to say?
I think, first of all, I want to thank you for your support and your participation. That's, I think, goes without saying, but it warms my heart and is so critical, and we really appreciate. So, thank you.
Thank you, sir. It's the
But
job of the media to propagate and bring further to the common people the things that are happening in the community which can be beneficial to them. And we are doing our duty, but kudos to you, as again I always say, you are so passionate about this subject that we get also motivated that this needs to further be brought to the people, and people can take advantage of all the work that is being done behind by people like you and your team who try to bring in the best to the common people.
yeah, no, I think for me, it's I'm just grateful to have the opportunity to be able to do it.
Absolutely.
Given my background, yeah.
Wonderful.
No, I
Wonderful.
think thank you again.
Thank you, sir. It was a pleasure talking to you, and thanks for this update. And definitely, every month, as we have you as a co host and we get different speakers come and talk about different important issues, we'll continue with that. Thank you very much and have a great day. Thank you.
Yeah, I approached some of these doctors I met in India, and they said they will be very interested in coming on the show.
Excellent, sir. Thank you. Take care. ਸੋ ਇਹ ਸਨ ਸਾਡੇ ਅੱਜ ਦੇ ਮਹਿਮਾਨ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ, ਕੈਨੇਡਾ ਇੰਡੀਆ ਨੈਟਵਰਕ ਸੁਸਾਇਟੀ ਦੇ ਬਾਣੀ ਹੈਗੇ ਨੇ, ਅਤੇ ਜਿਸ ਤਰ੍ਹਾਂ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਇਹ ਇੰਡੀਆ ਹਾਲ ਵਿੱਚ ਹੋ ਕੇ ਆਏ ਨੇ। ਕੈਨੇਡਾ ਇੰਡੀਆ ਨੈਟਵਰਕ ਸੁਸਾਇਟੀ ਇੱਕ ਉਹ ਸੰਸਥਾ ਬਣ ਚੁੱਕੀ ਹੈ ਜਿਹੜੀ ਕਿ ਹਮੇਸ਼ਾ ਹੀ ਇੰਟੀਗ੍ਰੇਟਿਵ ਅਪਰੋਚ ਟੂਵਰਡਸ ਹੈਲਥ ਨੂੰ ਅੱਗੇ ਲਿਆਉਣ ਵਾਸਤੇ ਯਤਨ ਕਰ ਰਹੀ ਹੈ। ਐਂਡ ਡਿਸਪਾਈਟ lot of barriers, Dr. Arun Garg is so passionate ਕਿ ਉਹ ਹਮੇਸ਼ਾ ਹੀ ਚਾਹੁੰਦੇ ਨੇ ਕਿ ਕੁਝ ਚੰਗਾ ਲੋਕਾਂ ਵਾਸਤੇ ਹੈਲਥ ਕੇਅਰ ਵਿੱਚ ਲਿਆਇਆ ਜਾ ਸਕੇ। ਬੈਸਟ ਆਫ ਦਾ ਵੈਸਟ ਐਂਡ ਦਾ ਈਸਟ ਨੂੰ ਐਮੈਲਗੇਮੇਟ ਕਰਕੇ ਇਹ ਚੀਜ਼ਾਂ ਨੂੰ ਅੱਗੇ ਲਿਆਉਣ ਵਿੱਚ ਆਪਣੇ ਯਤਨ ਕਰ ਰਹੇ ਨੇ, ਅਤੇ ਇਹਨਾਂ ਨੇ ਤੁਹਾਨੂੰ ਦੱਸਿਆ ਕਿ ਕਿਸ ਤਰ੍ਹਾਂ ਭਾਰਤ ਵਿੱਚ ਇਹਨਾਂ ਦੀ ਕੁਆਲਿਟੀ ਕਾਊਂਸਲ ਆਫ ਇੰਡੀਆ ਅਤੇ ਉਸ ਤੋਂ ਇਲਾਵਾ ਹੋਰ ਸੰਸਥਾਵਾਂ ਨਾਲ ਮੀਟਿੰਗਸ ਹੋਈਆਂ ਨੇ। ਸੋ ਥਿੰਗਸ ਆਰ ਗੋਇੰਗ ਇਨ ਦਾ ਰਾਈਟ ਡਾਇਰੈਕਸ਼ਨ। ਹੌਲੀ ਹੌਲੀ ਇਹ ਮੈਸੇਜ ਜਿਹੜਾ ਹੈ ਪਰਕੂਲੇਟ ਹੋ ਰਿਹਾ ਡਾਊਨ, ਅਤੇ ਤੁਸੀਂ ਵੀ ਕਿਹਾ ਜਾਂਦਾ ਪ੍ਰੀਵੈਂਸ਼ਨ ਇਜ਼ ਬੈਟਰ ਦੈਨ ਕਿਉਰ, ਜਿਸ ਤਰ੍ਹਾਂ ਡਾਕਟਰ ਗਰਗ ਹਮੇਸ਼ਾ ਹੀ ਕਿਹਾ ਕਰਦੇ ਨੇ ਕਿ ਆਪਣੀ ਸਿਹਤ ਦੇ ਸੰਬੰਧੀ ਅਸੀਂ ਆਪ ਇਸ ਦੇ ਉੱਤੇ ਕਾਬਜ਼ ਹੋਈਏ। ਕਿੰਨਾ ਖਾਣਾ ਹੈ, ਕਦੋਂ ਖਾਣਾ ਹੈ, ਕਿਸ ਤਰ੍ਹਾਂ ਖਾਣਾ ਹੈ, ਇਹ ਛੋਟੀਆਂ ਅਹਿਮ ਚੀਜ਼ਾਂ ਨੇ ਜਿਨ੍ਹਾਂ ਨੂੰ ਕਿ ਜੇ ਅਸੀਂ ਅਡਾਪਟ ਕਰਦੇ ਹਾਂ ਤਾਂ ਅਸੀਂ ਵੀ ਇਹ ਕਰੋਨਿਕ ਬਿਮਾਰੀਆਂ ਤੋਂ ਬਚ ਸਕਦੇ ਹਾਂ ਅਤੇ ਆਪਣੇ ਜੀਵਨ ਨੂੰ ਖੁਸ਼ਹਾਲ ਕਰ ਸਕਦੇ ਹਾਂ। ਪ੍ਰੋਗਰਾਮ ਦੀ ਕਰਦੇ ਹਾਂ ਇੱਥੇ ਹੀ ਸਮਾਪਤੀ। ਤੁਹਾਡਾ ਮੇਰਾ ਸਾਥ ਮੰਡੇ ਟੂ ਫਰਾਈਡੇ ਸ਼ਾਮ ਦੇ 6 ਵਜੇ ਪੈਸੀਫਿਕ ਸਟੈਂਡਰਡ ਟਾਈਮ ਦੇ ਮੁਤਾਬਿਕ ਹੋਇਆ ਕਰਦਾ ਹੈ। ਇਫ ਯੂ ਆਲਸੋ ਵਾਂਟ ਟੂ ਬੀ ਅ ਪਾਰਟ ਆਫ ਦਿਸ ਪ੍ਰੋਗਰਾਮ, ਔਰ ਇਫ ਯੂ ਨੋ ਸਮਵਨ ਹੂ ਕੈਨ ਬੀ brought here and who can add to our knowledge in any field, you are most welcome to contact me through WhatsApp 6046037555। ਪ੍ਰੋਗਰਾਮ ਦੀ ਕਰਦੇ ਇੱਥੇ ਹੀ ਸਮਾਪਤੀ, ਫਿਰ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ। ਹੈਵ ਅ ਸੇਫ ਈਵਨਿੰਗ, ਸਟੇ ਹੈਲਦੀ ਐਂਡ ਇੰਜੋਏ ਯੋਰਸੈਲਫ।